sense.
Jack.
John.
I thought we would take some time. In episode 1, we spoke about the article of the week, and you brought up chronic stretching and the effects. And I thought, let's do this. Let's talk about flexibility. We know that is well, for those who don't know, it's a huge area of interest for you. And I would say expertise. You might not necessarily feel like you've got there yet, but I definitely think that your knowledge in this area is really strong. And I thought, let's talk about it and some of the areas that are involved. It seems like flexibility has become, in some ways, the forgotten physical capacity. In some respects and in some areas, it's become really popular. I know that a few years ago when Kelly Starrett started to really push mobility, people got really interested in it. And it seems to have been really embraced by that sort of high-intensity training world, CrossFit, the body fit type stuff. They're really into that kind of thing. But in more sports performance, even in physiotherapy and physical therapy world, it seems that flexibility is not considered as beneficial as what I think we definitely see it as. And it's also probably not being considered at an assessment level enough for contributing to injury.
Yeah, and look, the framework we use, we consider flexibility, or thinking of movement capacity more general, as the base, the foundation.
It's a primary physical capacity that we think is important.
What I find amusing is, like, within physiotherapy, one of the first things you learn about is range of movement.
Yep.
Pretty straightforward thing to do, pretty easy to quantify. Yet, how many people do you know see a deficit in flexibility and will address it? It never ceases to amaze me that we're very quick to go towards doing either something that's trendy or something that's more high intensity. You actually don't have the foundation to move effectively without potentially compromising or compensating moving through another area.
We got into this briefly, like, to explain to people, why do you think range of movement or flexibility is important? Because we started this discussion and we spoke about the fact that you can get away with limited range of motion or flexibility around a joint or a tissue. And we mentioned the idea that potentially it has to do with the amount of variability there is in the activity that you're doing. But, in a more significant sense, what are your thoughts around why flexibility and range of motion is important?
What's also important to look at is flexibility. We need to look at the whole body, the whole system, because I think more often than not, you may see in an individual good flexibility in one area, poor flexibility in another.
Yeah, you speak about this. Why is that? Like, why does that actually occur? Because you get some people who almost seem hypermobile in one area and hypomobile in another. And it sometimes doesn't make a hell of a lot of sense on a superficial level.
Yeah.
All right. With your experience, like, why would you say that's kind of, that you do see that presentation?
Well, and I'd even extend on that to say you might see someone who has very good mobility of a joint in a relatively passive position, but then starts to have quite poor flexibility when you start to add more tension to the system. And
yeah, let's nut that out, because I think that's super interesting. What do you mean when you say tension?
Yeah. So, as the name suggests, creating tension within the system, which we can essentially do 3 ways: by lengthening a tissue. So we're talking about muscles, joint capsules, ligaments, other connective tissue structures; by contraction, because as we contract a muscle, we'll create more active stiffness and therefore limit the range of movement. And the other big one too is the rate of force development, or the speed of the movement. So this makes a lot of sense. Think about if you have someone lying down on the bed, moving their shoulder in through range of movement while they're being passive, you're going to be able to achieve a certain amount of movement. You get that person to do the exact same movement, where, again, you ask them to do the movement now, so we're looking at active range of movement. you may see a slight reduction in the amount of movement they have. Part of that has to do with as they start to contract their tissue, their soft tissue, their muscle, they're creating tension around that joint and potentially through the myofascial plane associated with that movement that starts to compromise the amount of movement they have.
Okay. Yeah, so that was always something like, I remember as a student, I never understood that. It's like, why is the active range different to the passive range? At a fundamental level, that never made any sense to me until, we started having more of these discussions, because you think, well, if I can move it through that range as the clinician, why can't they move it through that range as the individual? And there shouldn't be anything that's limiting that.
Well, this is where it's important to think about what's the biggest limiting factor to range of movement. And by far, that is your stretch tolerance.
Yep.
So when I say stretch tolerance, it's literally your central nervous system's ability to essentially accept lengthening that tissue to a certain range. So to explain that a bit further, the reason why a gymnast can do the front splits versus perhaps yourself.
There's no way I could do the front splits, that's for sure.
Is not to do with the actual structure of your anatomy, like your bony morphology or tissue system.
You hear of these discussions that if you were, say, anesthetized, I probably could do the front splits.
Absolutely.
It would look like Weekend at Bernie's, but...
Well, and even to take that a step further, you even see that in cases of people with severe pathology. So, again, orthopedic surgeons will talk about someone that they're about to do a total hip joint replacement on, who, when they're conscious, has very compromised or restricted range of movement, yet starts to essentially have normal range of movement when they're under a general anesthetic.
Yeah, and so what that stretch tolerance you talk about, like what is inhibiting that movement? Is it what are the messages that are going? What are the afferent feedback that it's getting to say I shouldn't go into that range?
Well, it's purely that, isn't it? So it's got to do with stretch receptors within your soft tissue network, sending a signal to your central nervous system, and your central nervous system interpreting that as non-ideal, non-optimal.
Yep.
And that's just reflective of your prior experiences. It's similar to, say, resistance training, where one of the biggest adaptations you'll see acutely within resistance training is neural adaptations.
Yeah.
Your ability to create stronger, a stronger central command from your central nervous system.
Yeah, firing rates
to your muscle.
Less inhibition. Yeah, it's interesting because this kind of idea clearly explains why we see changes quickly in things like flexibility. Right now, if I got on the ground and went to touch my toes in a hamstring stretch, initially it'd be pretty stiff. And if I hold this for 30 seconds, a minute, it seems like it gets easier. But clearly that tissue is not elongating, is it?
Well, no. I mean, you do see some changes in the viscoelastic properties of tissue that happen acutely. So they'll typically become less viscous and therefore more elastic. But that's quite transient.
We're jumping around, but I wanted to ask you about that. That viscosity. What affects that? Is it as tissue temperature? I know that we've spoken a lot about the connective tissue secretion of hyaluronan.
We are really going into
we're going into this. We're exploring flexibility. It's the name of this episode. Let's look at that, because I think one of the frustrations that you have, and I'm speaking for you, so apologies, but that I think I'm starting to take on as, you're helping educate everyone here more, is that people will make really broad assumptive statements about, flexibility doesn't do anything, or even things like we put up a post and a lot of people really liked it, was you put up about things like foam rolling and what effect that has. And people say, there's no evidence for it, doesn't do anything. And in the research studies that they do, which are usually methodologically extremely poor, they don't really look at the mechanisms for why it potentially works. And therefore, the outcome that they, as they say, rubbish in, rubbish out. They design it poorly to get an outcome that supports their confirmational bias that flexibility doesn't do anything. And the reality is, if you actually look at the mechanisms, it's pretty clear that you do get changes in the viscoelastic structures at a peripheral level, as well as these central changes that you're talking about in a relatively quick period of time.
Absolutely.
Right? And if you continue to do those, which we'll talk about more, but you'll get chronic changes because of other, stimuli that occurs at the tissue level. But what actually happens at the peripheral level, even in a short application of, say, stretching?
Well, to unpack that, you need to think about the actual configuration of the stretch variables. And this comes back to thinking of like, why do we need to stretch, or why do we need to have good flexibility? And there's different applications for different reasons. The most obvious one is if you see a deficit in range of movement, particularly, say following an injury where you can see an asymmetry, it can be very useful to try and address that, and flexibility, time and again, shows to be a really effective way to do it. Then we need to start thinking about, are we applying stretching, say, in the acute warm-up setting? Are we applying stretching?
This is timing. You're talking about timing.
This is about timing. Because again, like any training modality, how you configure the variables. So this is a really important thing to highlight when we think about stretching.
Why do you think, because I know you'll talk about, timing, the duration, the number of sets, for instance, of the stretch that you'll do, the intensity of the stretching. And these are all variables that straight away we think about with resistance training. We think about if we prescribe running. We think about it if we prescribe lots of different modalities. Why do we not think about this when we prescribe flexibility? We don't think about, if we prescribe a 10-second stretch, that stimulus is probably not going to be significant in the same way that we would if we said, we just want you to do bodyweight exercises. Right? We know the bodyweight exercises are going to have some effect, but they're not going to be anywhere near as much stimulus because the intensity is low compared to, say, a maximal resisted, squat or something like that compared to a bodyweight squat. So why do you think that we haven't developed that same level of discussion around a prescription of something like flexibility?
Lack of understanding of principles of exercise prescription, and understanding how the human system adapts to stresses is what I would say is
because really stress is stress, correct? And you can manipulate those variables as you see appropriate for that individual and maybe the deficits they have.
And look, part of that also I think there's a few things to consider with stretching specifically. Stretching is actually quite an uncomfortable thing to do. I actually think a lot of people don't enjoy stretching.
No, I don't think they do, because in many ways, it's often more uncomfortable than lots of other types of training stresses that you may apply.
Absolutely, yeah. And the reality is, depending on your personality type, you may be someone who's willing to explore that experience more than others. Then we have the other big issue too. We're talking about like stretching and why it's out of vogue. Something we briefly mentioned on a previous one is looking at the literature around stretching. I think this is worth highlighting again because there are several studies that follow a very similar methodology, and it's the same process of if you get someone to do static stretching for very long periods of time, and when I say long, I'm talking 15 minutes. And then following that, get them to do some type of performance measure.
Yeah, dynamic task.
Yep, strength, sprinting ability. You see a decrement in performance. I don't question that whatsoever.
No, the findings that they present are clear.
But it's not representative of the real world.
Yes, as we mentioned on our first recording, as a sprint coach, I would never say to my athletes, whether they're doing dynamic or they're doing static stretching, they're not going to go straight from the stretching or flexibility component into the maximal sprinting.
Yes.
There's always going to be a bridge where it's part of the warm-up scheme and it's integrated in there because we're trying to keep those available ranges of motion through different body segments or, whole chains of movement. But it's never going to be the sequences right before the maximal effort.
No, look.
Or the testing effort, which is what essentially they're doing in those studies.
Yeah, and I mean, hopefully it's quite clear to anyone that if you think about a warm-up, you might do some low-level activity to warm the body up, like literally in terms of getting the temperature up.
Yeah, tissue
do
temperature.
some sport-specific stuff and then build up that intensity. And then you can also include stretching early on there too. And if you stretch, it's probably going to be 5, 10, 15 seconds. The research shows that even up to 30 seconds and even sometimes 60 seconds, it's fine. You're not going to get a decrement in performance. And then if you look at the research where you're actually using stretching in a practical way, where you're doing a little bit in an integrated warm-up, where you're doing all those other things, the outcome is either no difference or potential improvement in performance. And then, of course, when we think about within our world from a rehabilitation standpoint, the application of stretching prior to an exercise rehab session is paramount, particularly to be able to create that acute enhancement and flexibility. So going back to thinking of why is stretching not heavily utilized, one key element is the poor appraisal of the literature. And for reasons unknown, I'm always amazed to see of how many times you'll see that poor methodology of doing really long periods of stretching in isolation, followed by looking at a performance measure is done. There's actually a lot of studies just doing that methodology, and it doesn't make any sense whatsoever.
Yeah.
What's interesting to note, though, is you still see stretching utilized a lot within the real world and within lots of different sporting settings.
Well, it's interesting you say that because, again, this is anecdotal, but you see the discussions that occur between coaches, and they will still prescribe stretching even though the literature suggests that it's not necessarily effective.
Yes.
And there are athletes that will stretch irrespective of what potentially their performance staff or coaches will do or say to them. They will still do those activities. And I think it comes back to what you mentioned before about stretch tolerance. I think even very short bouts and short duration starts to have an effect on those, central mechanisms. So you do a stretch and you only hold it for 7, 10, 15 seconds, but immediately you feel like you have more available range.
Yes. And this, I think, brings on to another important point to understand with stretching is how it improves your freedom of movement.
Yeah.
I think the greatest example of that is look at gymnasts. Their physical capacity is quite impressive. And of course, gymnasts typically start quite young and they implement flexibility training very early on, which my experience is a lot easier because I look at stretching or flexibility as something you lose as opposed to something you gain. I'm not saying that you can't gain flexibility, but as we get older and we become sedentary, and this even happens in childhood and teenage years, you lose flexibility.
Why? Why is that?
Well, we don't spend time moving through large ranges of movement. Think about what we do.
And what's the underlying? We've had this discussion, so we should pass this information on to the listeners. What actually is the mechanism that causes that? As you get older, you seemingly lose range, you get stiffer in terms of your tissue capability to stretch and the compliance. What's actually happening at your tissue? Why is, and this will bring us back to why it improves, because we can talk about the chronic adaptations and what's happening, but why do you actually get stiffer? What's actually happening at a tissue level?
Well, most of it is still centrally mediated.
Okay.
So most of this still has to do with a reduction in your stretch tolerance.
So the good thing there that straight away highlights to me, and I think straight away it means that even if you get particularly stiff as you get older, you can regain a lot of your movement.
Because remember, going back to our analogy of thinking of why you can't do the front splits, because it's got to do with your lack of stretch tolerance. If you attempted to do that, the thing that's limiting you is as you start to stretch out those stretch receptors, it sends a signal to go,
this is dangerous. You're going to damage tissue.
Well, and it's probably even a better way to put it is this is unfamiliar territory.
Yes. Okay.
Because I think it's too fear-mongering to say that this is dangerous, because it's actually not dangerous. But
yeah, I know what you mean.
The brain will perhaps look at it as I'm not used to this, I'm unfamiliar with this. Yeah. So you get contraction of muscle. So that's essentially what's limiting your range of movement.
Yeah.
That's actually problematic in itself. And it's interesting to note that we actually experience this all the time in athletic endeavors, because as you start to sprint, change direction, do a large range of movement in the gym. As you start to just stretch the tissue, particularly when it's contracting, you're creating a high amount of tension within the system. So if your body is unfamiliar with the amount of tension it's experiencing, it may start to alter the contraction or the neuromuscular patterns that your system's creating to complete that.
So, it's like an inhibitory feedback loop.
Absolutely. And this is something that anecdotally I've seen a lot, and particularly looking at athletes who are have quite extensive training history, particularly in resistance training, where they're reaching plateaus in their development and they've seen quite large improvements in, say, their 1RM from adding stretching into their training protocol. And I think a lot of that happens because of that phenomenon.
Yep.
Because all of a sudden, you're not necessarily making the muscle stronger, so to speak. You're actually not changing anything peripherally. But what you are changing is your brain's perception of going, okay, I'm familiar with this tension that you're creating. I don't have to create those inhibitory signals. And this is where I think you see a lot of improvement too, from an athletic standpoint, is not just simply the available range that you have, which may be important from a biomechanical standpoint to be able to achieve the certain angles that you need for for instance, something like sprinting, but more allowing your body to achieve those positions without getting to that threshold of going, well, hang on, I'm not used to this tension.
Range,
And that varies a lot, because what's also very well known is you'll see changes in what that point is based on how much that person slept, have they actually warmed up properly, hydration, what their current training program looks like, and whether they're feeling some level of fatigue. So that's something that we can manipulate by applying stretching and making sure that, if nothing else, that their stretch tolerance stays at that level. Because one of the issues you face with most of the training modalities athletes do is it actually reduces your stretch tolerance.
Yep.
And that's the issue that you have, where it's going to get to a certain point over time where your stretch tolerance is so low that you'll start to get a lot more of those inhibitory signals being
and that's
sent.
what you're saying, like it's something we lose over time rather than something you necessarily gain. So on that, then, if we've spoken clearly then about the central drivers, what are the peripheral, what's actually happening at the tissue level? Can you describe what changes you actually see, even if it's in the short term? And then we'll talk about chronic adaptations that occur, because I think that'll answer the gymnast topic that you brought up.
Yeah. So one of the big factors that you'll see too with stretching is fluid dynamics. So seeing fluid being distributed or changed within the connective tissue system. And this is why you'll often see initially with acute stretching, you may see a reduction in the passive stiffness, but then you see it going back. And actually, depending on the intensity, if the intensity of the stretch is large enough, you actually see an increase in the passive stiffness after a certain period, after about 30 to 45 minutes.
Yeah, because fluid's actually been driven into that connective tissue structure.
Correct.
Yeah,
yes.
And it creates almost like hydraulic pressure. Like hydrostatic pressure almost.
Like osmotic, it's got to do with the osmotic gradient. Yes,
that's correct.
That's the word I'm looking for. I think the other thing too that's important to consider is how it changes the sliding within the interfascial layers.
Yep.
So
this is like, for people, I think there will be people who, when they hear, fascia and myofascia, they kind of put that in the, almost
too hard basket.
I don't know, too hard basket. I think it's an area that we talk about a lot, and people probably think it's a little bit left of, center kind of stuff, that it's, be out there.
I think the issue with the fascial system is it's hard to be able to conceptualize, because it literally permeates every part of your body. And so it takes, the other thing too, when you start to learn more about the connective tissue network, is it starts to disrupt a lot of your ideas about how forces produce within the body and how forces are distributed through the body as well.
Yeah, I think we'll touch on that when we do a podcast on biomechanics and actually what the bio part of it really means, rather than just the mechanics and the physics side of things. Continue what you're saying, mate.
Well, one other important thing related to your flexibility as well is as we create contraction and create movement, we have to understand that there is sliding within different fascial layers. So if you take a step back, you think about the myofascial system. You'll always hear me refer to it as a myofascial system because you can't separate
muscle and connective tissue.
Correct. That when you think about the interface between a muscle, or when you think about the interface between the muscle and the overlying aponeurotic fascia. So just to explain what that is, think about in our arms and legs, we've got our skin, we've got our subdermis, we've got our retinaculum cutis, and then we've got the superficial fascia, and then we've got the deep fascia. So within our arms and legs, we have what's the deep fascia. That first layer is called the aponeurotic fascia. And you can essentially think of these as like stockings of the arms and legs.
Yeah.
So to help explain and visualize this, think of the iliotibial band. The iliotibial band is simply a thickening of the fascia lata of the thigh. So we have this aponeurotic fascia covering the thigh, the anterior, posterior, and medial.
Yes, in layman's terms, it would be like a stocking with a side insert.
Basically, and it's just and the iliotibial band itself is not actually separate from the fascia lata.
Yeah.
And then we have the continuation of that into the crural fascia. And then so underneath the aponeurotic fascia, you've got the epimysium of the muscle and then the muscle itself. And then you can think about the interface between different muscles within a compartment. And you can also think about the intermuscular septum between the interface between different compartments. And at these interfaces, you have loose connective tissue. And as we create movement and contraction, we get a certain amount of gliding between these interfaces. The amount of gliding that you experience varies. And that even varies from something like temperature. So as you warm up, you'll start to see a change in the amount of gliding that occurs.
Yeah, and that's where you mentioned viscosity and
correct
tissue temperature having an effect on those kind of viscoelastic features.
Yeah, exactly. What's also important to note is the fascia is extremely highly innervated. It's highly innervated with these free nerve endings.
We're going to come back to this because I think it's important of the feeling that you get with stretching is everywhere. But we'll come back to that.
Yeah.
Keep going with it.
Well, I was just going to explain, and those free nerve endings are mechanoreceptors. So when I was talking about these receptors within the periphery, we've got things like muscle spindles as well, and our Golgi tendon organs, but we've also got these mechanoreceptors. And as we start to stretch, we're going to see changes in the viscosity of the loose connective tissue between the interface, where it becomes less viscous and essentially more lubricating, and we get more gliding.
Yeah.
Now, you're going to get that too from just warming up in general.
Yeah. So the general warm-up and movement, even if it doesn't necessarily go into those greater ranges, we'll start to get some of that tissue gliding.
Correct. And that's why if you get into a sauna and then try to stretch, you're going to see an improvement.
Yeah.
That's why I think something like, Bikram yoga from a marketing standpoint is really popular.
Work perfect, yeah.
Now, there are issues with that too, because, particularly for people who are hypermobile, there is the issue of potentially being able to be so flexible that you're starting to stretch out some of the capsular ligamentous structures. So, you have to always be careful with that. But certainly from a peripheral level, we're seeing changes that allows an improvement in the gliding of these fascial interfaces that then again reduces the amount of inhibitory feedback sent.
You mentioned the innervation of the tissue. It's also very reactive in the sense that it actually will take on that stimulus that you're applying, and it'll even secrete, lubricant itself.
Yep.
Do you want to describe sort of how that occurs and how that helps with that gliding?
Yeah. So this is where understanding the fascial physiology is really
it's just so active, and I think that's the really interesting part. I see stupid arguments on dumb platforms like Twitter where people say you can't stretch the ITB, and the ITB, you can't change tissue, stop rolling, stop doing it. And it's just a very naive, poor understanding of how active these tissues are, even though if you were to separate them from the body and try and stretch them, they're very difficult to mechanically stretch.
And it's the issue of, I see it at the moment too with muscle, where it's this reductionistic approach of it's only about the architecture. Because, the reality is fascia is highly stiff. Now, it's very adaptable. You're seeing a lot of turnover. But whether you actually get structural changes to the collagen laydown from stretching, unless it was some really intense stretching, which there are some studies looking at that, you might see some structural changes, but you probably need something of a higher magnitude of stimulus. It's the same, though, with like the muscle stuff too, where muscle architecture is a very in vogue thing.
Yeah.
Now,
fascicle length,
completely
pronation angles. Yeah.
It's not to suggest that it isn't relevant. It certainly is, but it's certainly not the only thing that determines the force reduction, force capacity.
And people are trying to extrapolate that into, say, injury risk profiles, but it seems like it's obviously much more multifactorial than that.
Yeah, and so going back to your point, it's when we think about the fascial network and say, for instance, its application is stretching, the peripheral mechanisms are mainly related to the extracellular matrix.
Yeah.
So think about any tissue, fascia is the same. You've got your cells, so fibroblasts are the main one, and you have a lot of fasciocytes, which secrete hyaluronan, which is the compound that impacts the viscosity.
Yeah, so it's like the lubricant as we spoke about.
Depending on its actual size and depending on how it aggregates with other hyaluronan and water. And then you've got your collagen fibers, and then you've got the rest of the extracellular matrix, which is things like hyaluronan, proteoglycans, and so on. So most of the changes are happening to the extracellular matrix outside of the collagen.
Okay. And going back to that topic of the chronic adaptations, what's happening if you keep applying stretching, and we'll use the example of, say, a gymnast who starts applying flexibility training, stretching, other range of motion exercises, and their activity goes through large ranges at different velocities, and obviously probably quite significant volumes. What's actually happening to their tissue? Is their tissue the same as mine, and they've just got really good stretch tolerance, or is their tissue changed?
Yeah, so in short, you can see peripheral adaptations from stretching. So there have been a few studies now showing that you see architectural changes to muscle with long-term chronic stretching.
What are they?
So it's got to do specifically with the fascicle length. So you mentioned this before. Think about the muscle physiology, where we have the superficial and the deep aponeurosis of the muscle, and then the fascicles that go from one end to the other. We can see an increase in the actual length of the fascicle, and that influences the biomechanical behavior of the muscle.
Question: I don't think I've actually asked you this. Do you think that, therefore, the length at which the tension is occurring is the main driver rather than the actual amount of tension?
Oh, absolutely. So that's actually quite well established. Like if we think about the literature surrounding changes in muscle architecture, obviously it's quite big at the moment to talk about eccentric contractions. And again, there's certainly studies showing that particularly with high force types of eccentric contractions, you see a change in fascicle length.
Yeah.
That's not the only thing that you see changes in. So there's actually research showing that doing concentric contractions at long lengths also can improve fascicle.
So it's more about the length rather than the direction of
creating active tension in the lengthened position, because that's when you're going to get tension put in the passive tissue, the elastic tissue elements. So particularly titin, which I know you're probably familiar with. So there's a lot of models now looking at muscle of the three contractile component. So thinking about actin, myosin, and titin. And titin is
it's a lesser known component, isn't
absolutely. But we know that titin plays a really important role, particularly when doing stretch shortening cycle. And similar again when we see about changes in architecture, it seems to be about reaching the threshold necessary in titin to essentially send signals to go, we need more sarcomeres in series, i.e. longer fascicle lengths.
Okay.
So there is research with stretching showing that. I think that's something, though, in order to achieve that, it's going to be something that you have to do really long term and make sure that like any training modality, intensity increases.
Yeah. Actually, like you've spoken about prescription just there. I want to ask you, because I don't know that we've even spoken about this. Do you think if you decide, okay, I think this person has a lack of range that is causing potentially, well, that deficit is causing, say, increased injury risk, and it's limiting their movement capability, therefore their performance may not be as good. Do you think it's important to address it in a range that's around the flexibility range that they're going to need, or the range of motion they need? Or do you think it's worth going much broader than that? Is there benefit in going to, say, for instance, you've got a team sport athlete who's kicking a ball, they may never need to be able to do the front splits. Is it worth them being able to do it? Do you think that the prescription should overshoot the target a little bit in order to maintain, because as you said, the activity itself is going to draw that flexibility back, or is that going to create too much stress in order to actually achieve that?
Well, I mean, most of the time with stretching, if we're talking about, general population, I'm talking about an adult athlete, you're going to be getting quickly to the end of range with stretching, and, you're not going to see necessarily big gains, particularly if they're applying other training interventions. So I typically don't see that as much of a problem. I look at it like building any biomotor ability. I think about building flexibility reserve, similar with strength training. Like, the reality is, do you need to be able to squat 2 times your body weight to play soccer, football, hockey, whatever it may be? No. Is it beneficial? Most likely, because you're going to build up a reserve, and you're going to build up essentially more tools that your sensory motor system can use to then solve that problem. Remember too, you also see changes. One of the benefits of stretching from an injury prevention standpoint is how it changes the strain experience of the muscle when performing whatever athletic task or movement that you're doing. So as you stretch, you see improvements in the optimal muscle length. So what I mean by that is the length at which your muscle produces its maximal force. So what we see with stretching, and we've seen this when you look at stretching interventions or look at gymnasts, is that they can produce their maximal force at longer muscle lengths.
Yep.
To give you a comparison, that's what you also see with eccentric training. Yep. So you see a shift of the length tension curve to the right. You see the exact same thing with stretching.
And so the question I have with that is, do you think that by applying stretching, you may be able to get some of the benefits that are being espoused for eccentric training without potentially some of the downsides of eccentric training?
Oh, absolutely. And
do you think that's, to me, that's interesting, and it's also very practical, but yet it's not necessarily maybe well known about, or the fact is that maybe even people would dispel it and say, well, that's unlikely. Do you think that that's something that, as people's knowledge of something like flexibility goes up, they'll actually realize, oh, wait, we can get these changes by applying this, this intervention, which is, I would say, probably less stressful than, if it's applied correctly, than eccentric training. And you may be able to get the benefits without necessarily, one, probably needing equipment, or even needing, to apply a highly stressful stimulus.
Yeah. And look, I'm not necessarily suggesting you do stretching over another intervention. I always look at this as added addition and potentially exponential outcome.
Yeah, it's always, I think that's a big problem when you have the mentality of this or this. It's always and. You can choose.
Turns out you can actually have both.
Yeah. You can choose what recipe you want to put together based on that individual's needs.
So, look, just to, I think, flesh out what you're suggesting there, one of the issues with eccentric training is getting exercise-induced muscle damage and DOMs and...
Yeah, well, even, I know that I shared with the group, in our clinical group, a paper just talking about the fact that with a lot of the eccentric application in, say, Nordic hamstring exercise, one of the big things that's really been held back in more athletic populations with the research is compliance. And the reason is because you apply it, even if it's a very small dosage, and the athletes will complain of particularly soreness in the following days, and they feel that takes away from their ability to participate in their sport. Whereas the sense that I'm getting is that you could apply something like stretching, which, despite the stimulus may not be as aggressive at the time, the soreness will not be anywhere near as severe, even if you do have soreness, and therefore you can get benefit to those peripheral tissue changes we spoke about.
Absolutely.
And are being, as I said, espoused as being really beneficial from eccentric training without some of the downside.
Yes, and I think some of the mechanisms that cause that improvement in the length-tension relationship are unique to stretching, because you may not always, at least in the acute setting, get changes in the muscle architecture. I think that's more of a long-term thing.
That's more of a chronic.
It's probably more got to do with, again, thinking about some of the mechanoreceptors within the connective tissue network and how they influence the behavior of muscle or motor unit recruitment, and particularly as the muscle lengthens over time. It's interesting to note too, like just thinking about the list of benefits of stretching, of when we talk about muscle damage, as you stretch, you will see reductions in passive stiffness. And we know that there's a very strong correlation between passive stiffness and the amount of delayed onset muscle soreness you experience. So one of the benefits you'll see from stretching as well is you'll experience less DOMS from damaging types of
Is that stretching being applied as an intervention post, say, something that would typically cause DOMS, or are you saying as a chronic adaptation?
You actually see them both. So they've done it. They've done some studies of looking at doing.
So you do your exercise. You know that, say, it's heavy resistance training. You're typically going to have quite a significant amount of DOMS. You do, following that, you would apply some form of flexibility intervention. You know, you might stretch that body part or segments across, whatever period you want to do, multiple bouts of 30 seconds, 60 seconds, whatever that might be. And you're saying that there actually is evidence to suggest that you will actually have less delayed onset muscle soreness because of that intervention application.
Yeah, and there's a study I'm thinking of now too, that also looking at stretching in as a part of the warm-up prior to doing the muscle damaging type of activity too. You'll see.
So a pre-post application is actually useful.
Yes, yeah. I was actually just going to mention before, just before I lose my train of thought, when we're talking about stretching, I was talking about muscle strain, because with stretching, you see that improvement in the length-tension relationship, so reducing your peak force at a longer muscle length. We see changes in the muscle strain then experienced from doing that activity as well. And when you think about strain being the main mechanism from which soft tissue injuries occur, you can see how that's really useful from an injury prevention standpoint. Because,
well, I know that Tony Blazevich spoke about this in one of the podcasts that he did. That there's significant volume of research. And I think it was in one of the systematic reviews that he spoke about that shows that stretching actually reduces injury strain risk, or muscle strain injury risk, and the overall injury risk. Yet, typically you hear the same thing, stretching doesn't reduce injuries. And that's actually not true. And he actually said that. And I don't think anyone would argue with Tony Blazevich's, background or understanding of the topic.
Oh, he's certainly one of the leaders in terms of the field,
So I find it really interesting that there is that idea that flexibility training and stretching doesn't actually reduce injury risk, because it's clear that it does.
Well, look, it's probably worth talking about this briefly too, thinking of why that is and what you also need to be careful of, I think, with stretching. Because I know, anecdotally, we've talked about this before, that different profiles have different responses to stretching. And not just acutely, but even within the ensuing days. And I think there's certain profiles, certain personality traits that determine how a person responds to it.
You mean someone who's really uptight?
Basically. You certainly see some people who, I think also a big part of this has to do with how wound up someone's neural system is. Because we do see that with stretching, we see changes in neurotransmitters within the central nervous system that will impact their autonomic nervous system output. So, i.e., the sympathetic to parasympathetic outflow.
Because I think this is the part where we can talk about this, brought it up briefly. A lot of that seems to be also associated. They come in, as you said, they're a bit more uptight in general. They tend to be stiffer in terms of their tissue compliance.
Absolutely.
And when we're talking about passive stiffness.
Yes.
And when you apply stretching or flexibility, they experience a lot of discomfort, which seems to then almost, wind up their autonomic nervous system more because, they get a sympathetic response. They're in pain.
Yes.
And so it's a perpetual thing. Now, not that going like onto the side of what they're experiencing with that pain, when you get that pain stretching, what is that feeling? What actually is the tissue that's causing that feeling? Because you hear people say the term, and I hate this term, it's like a neural stretch. And it's clear, or at least it's clear from what I understand, that it's not from stretching of the, neurological tissue, whether it be a nerve or its surrounding, structures. Is that true, or am I getting that wrong?
No, it's for the profile that you're explaining then, it's very unlikely that they're actually stretching out their actual neural tissue. There are some case studies in, say, gymnasts whose flexibility is so good that they've actually caused some neural damage. But again,
most people aren't approaching those ranges.
We're not talking about applying stretching to a gymnast, because the application of stretching to a 15-year-old who's got 10 years of stretch training history is going to be very different to a 25-year-old who's got 0 years of stretch training history. Yeah. So it's really important to separate those two things out, okay? We need to think about the context. In that situation, the thing that you're winding up is your fascial network.
Yeah. And so that feeling, that you get, say, you touch your toes and you get that feeling down the back of your legs, and people say, oh, yeah, it's like a neural stretch. That's not particularly neural tissue that's causing that feeling, is it?
Most likely not, no. And you'll see that varying from person to person and depending on the stretch, because you can get the feeling of the muscle stretching, but that's more got to do with the muscle contracting at a lengthened position. Essentially what you're creating is like an isometric contraction in range, but then you have more that feeling of like, I feel it through the whole back of my leg, which most often is fascial in nature. If we're talking about that person who's quite stiff and doesn't have obviously any indications of like neural damage.
And is that why, again, it probably reiterates the point that because it is so highly innervated and those mechanoreceptors are within that tissue, the stretch tolerance, as that changes acutely, will remove some of that, fascial tension feeling, or, as people describe that neural tension. They'll say, oh, they did a couple of minutes of stretching and say, oh yeah, that feels less neural than it did before. Oh. And that is that acute change in that stretch tolerance that we see, because those mechanoreceptors have started to understand that range is acceptable.
And potentially altering some of the peripheral sliding of the different interfaces.
Yeah, so it's the combination of those factors, yeah.
Correct. Because, even if you are experiencing, say, I think of this with your neurodynamics, like if you're doing a sliding of neurodynamics, what are you actually doing? You're trying to essentially alter the sliding of the nerve relative to the surrounding connective tissue.
Yes.
So the endo, the peri, the epineurium. It's not that you're actually going to
stretch the actual nerve structure.
No, but you're altering, again, the viscoelasticity and the gliding between those interfaces. So I typically look at it too of depth. So when
you say depth, what do you mean?
The depth of the tissue relative to the skin.
Okay, yep.
So I typically look at it as you're going to stretch more the superficial before you stretch the deep most of the time. When I think of, say, like the fascial network, at least anyway, compared to the neural network. So unless you've got very, very good fascial compliance, I'm not concerned about the neural tissue being overstretched from stretching.
Okay. I think to wrap this up, let's briefly talk about prescription. Mm-hmm. What are some of the things to think about when it comes to prescription? How would you, everyone's would at a basic level understand if you want to get increased strength, you're going to use rep ranges of 5 to 12 and you're going to do 60%. It's more complicated than that. We'll have
to talk about that another time.
We'll talk about that another time. But say people know, okay, generally it's a rep range here to here and it's at this percentage of intensity. Do you have similar kind of broad ideas around prescription of flexibility and stretching? And what are they, I guess?
Yeah, absolutely. So again, think about the context. So if we're thinking about using stretching acutely within an integrated warm-up, we want to make sure that we're doing shorter stretch durations. Now, you can still stretch up usually to 30 seconds and not have any negative effect. And think about it. Most people, when you see them stretching in a warm-up, it's a few seconds, if that. Typically, I think you need to do a little bit longer than that, 10 to 15 seconds at a minimum. And you only need to do really one set of each stretch within that warm-up. That changes over time too, depending on their stretch history. So if you've got someone who's more familiar with stretching, you can utilize more stretching within that acute setting within an integrated warm-up. And I think that's really important because just like any training modality, the more you expose your body to it, the less of those negative side effects you get acutely from, say, saunas and things like that. But really, we need to think too then, if we're using stretching as its own intervention, say whether it's part of your warm down or as its own little training session, we need to be we need to stretch more. So a lot of the time you'll see people prescribe stretches and they actually don't give any indication of
they're not saying, oh, you need to do 3 reps of 1 minute, and I want you to hold that position. And it's very much just do some stretching for your hamstrings, your calves, your back, whatever it may be.
Yeah, exactly. So if I'm just looking at someone who's got poor flexibility, I'll typically prescribe similar to what I would do in resistance training, where you might be doing, say, 3 to 4 sets and anywhere from 30 to 60 seconds, depending on the stretch. Some stretches, I might get them to hold less if it's actually more intense. So like it takes a bit more effort to hold it.
And is that something that you do based on that profile stuff that we spoke about before? If someone is particularly poor in their range and you know the intensity of the stretch, whether you like it or not, is going to be more significant, do you make them potentially do more reps but a shorter duration because the intensity will be different?
No, I try to give them exercises that I think are appropriate for
it's more about exercise selection at that point.
And the good thing too about stretching is it's quite easy to alter the intensity of a stretch based on the depth.
Yes.
That brings into the next point of making sure that the intensity is there. I think one of the big issues you see is people will go into, very mild discomfort at best. Again, it's just a basic principle of adaptation. You need to make sure that you reach a certain magnitude, which you can do either through volume, but do you want the person holding it for 10 minutes? Probably not that pragmatic. Or intensity. Yeah. And so actually going to the point where I want them to feel the stretch. I want them to feel quite a high level of discomfort. I want them to be able to breathe though too.
Yeah. What's if you were to say like the rating of perceived exertion or rating of discomfort in terms of pain out of 10, what would you be comfortable with?
15. No, really. That's a good question. What do I think?
If someone's saying like it's 6 out of 10 pain, are you okay with that or discomfort?
In short, yes. I use their breathing mechanics as a big indicator.
Okay, so if they're having to hold their breath and they can't breathe, that's too much.
Exactly, yeah. So I'll often, it's a fine line because within 5 or 10 seconds, they could be holding a stretch that's 6 out of 10. If they actually work on the quality of their breath, they could go down to a 2, 3 out of 10.
Yeah. And that, again,
I want them to make sure that they actually keep pushing towards that 6 out of 10.
Yep.
I want to make sure
that intensity, just the depth needs to be maintained or continue to go further so that it's maintaining that level of intensity. It would be like, for instance, because that level of tension is the thing driving it, it would be similar to, say, for instance, if you had a bar and you were lifting and as you kept lifting, the weights were being taken off. Right. And so all of a sudden the stimulus is getting less. They're saying, oh, this is only 2 out of 10 difficulty. You want them to keep adding more until it's 6 out of 10 all the time.
Absolutely.
And obviously that doesn't make sense in a resistance training setting, but you're maintaining that level of intensity throughout. And it's probably similar to, say, some of those isokinetic kind of loading strategies that are used on different machines.
Yeah, exactly.
You're maintaining that level of intensity throughout.
Yeah, and that requires effort from the individual. So that can be a learning curve in and of itself, because more often than not, you realize that people will want to fall into that comfort zone again.
Yeah, so they'll want to sit at 2, even
Correct.
though, it's not creating the greatest stimulus.
Yes. Tied in with that too, I think this is a really big one.
I guess that's education, isn't it?
Yeah. And I was just going to say, one other thing I think is really important with stretching is the quality of movement, because where do you want the movement to occur? So if you're doing like a seated straight leg forward bend,
So trying to stretch out, that whole posterior chain.
that whole posterior chain, looking at the quality of movement, where the movement's coming from, is also going to give you information and provide cues to what the patient needs to do to make sure that they're, the obvious one being actually tilting at the hip and creating hip flexion and not flexing through the spine. Because again, more often than not, you want to be, say, stretching the hamstrings and seeing an improvement in that anterior pelvic tilt relative to seeing an increase in spinal flexion. I was going to say too, often depending on what I'm trying to stretch, I might do, and the type of stretch, I might get them to do some longer stretches. So a classic example being someone, say, post joint surgery, where there's got a lot of scar tissue and joint restrictions. When they're able to do it, I might get them to hold a particular position for 5 minutes in order to create stretch more within the at the capsule level and potentially change the
because you're trying to elongate tissue.
Mm.
All right. I think that has given people some background. Hopefully we get some feedback on that and we can maybe explore other areas that are interesting to people. But thank you for sharing your knowledge, mate.
Thank you, John. Where are we at?